Hi, I'm Dr. Suman Singh, Senior Obstetrician, Gynecologist, and IVF Specialist working at Mansi Clinic, BTM Layout, and Rainbow Hospital, Mankatta Road, Bangalore. Let's talk a little bit more in detail about the metabolic complications of PCOS. So the first thing that we talk about is insulin resistance. In the normal population, we find insulin resistance to be to the tune of 15 to 45%, but in PCO patients, it is to the tune of 50 to 75%. What are the clinical features? The lady can have acanthosis nigricans, central obesity, and also skin tags. What are the tests to be done? Fasting blood sugars, a blood sugar 2 hours after a meal, fasting insulin test again 2 hours after a meal, or a glucose challenge test. Now, what are the complications? Complications can be impaired glucose tolerance, diabetes, non-alcoholic fatty liver disease, gestational diabetes, miscarriage risk, and of course, full-blown diabetes later in life. The second complication that we worry about is diabetes. So, in the general population, diabetes is to the tune of 14% in women, whereas in PCO, the incidence increases 5 to 10-fold. And what are the symptoms? So, polyuria, that means you feel like passing more urine. Polydipsia, that means you feel like drinking more water, and weight loss. How do you test? Again, blood sugars. You can do a fasting blood sugar or a sugar test post-meal. And here, it's important to control diabetes because it can cause multi-organ disease. A diabetes which is not controlled can affect the nerves, the heart, the brain, the kidneys, and so on. The other complication is liver problems. Okay, so women with PCO can have almost 30 to 60% incidence of non-alcoholic fatty liver disease. So here the symptoms or the clinical features are non-specific. You can do a liver function test to understand if you are suffering from this. And of course, if not treated, it can lead to cirrhosis and also hepatocellular carcinoma. What about the lipid profiles? Lipid profiles again are increased drastically. Therefore, we ask for a fasting lipid profile. And this is important because if not corrected, it can lead to increased risk of cardiovascular disease and strokes. Now, metabolic syndrome. We all are talking about PCOS as a condition which has a lot of metabolic complications. So metabolic syndrome, if you see in the general population, is to the tune of 35%, but in PCO patients, it is found to the incidence of 46%. How do you diagnose metabolic syndrome? So if the abdominal circumference is more than 32 inches, or the BP is more than 130 by 85, or if the fasting sugar is more than 110, or if the HDL is less than 50, or the triglyceride level is more than 150, then these patients are prone for metabolic syndrome. And here again, it's important to correct it. Otherwise, the risk of cardiovascular diseases, the risk of strokes, the risk of cancer, depression, all of these can increase. Now, speaking about depression and anxiety, the risk is almost doubled in PCO patients. So the woman can experience low moods, depression, anxiety, loss of interest in her surroundings, and they can also lead to suicidal tendencies and cardiovascular problems in the long term if unchecked. Women with PCO also suffer from obstructive sleep apnea, and the increased incidence is almost more than 3 times. So they complain of disturbed sleep, snoring, apneic spells, and daytime sleeping because of poor quality sleep. Over the long run, this can lead to hypertension, metabolic problems, diabetes, and of course cardiovascular diseases. Now, endometrial cancer. This is again something that we worry about, and the incidence is almost 2 to 6-fold in PCO patients. So they can have abnormal bleeding through the vagina, or they can have abnormal discharge. Testing is done through endometrial biopsy, and it is important to evaluate these patients early to reduce the morbidity and mortality. So PCO patients need now to be evaluated on several levels, not just about their cycles, not just about their fertility, their ovulation, but we need to look at them more comprehensively and treat them as a whole.